I want you to swallow once and notice what you feel at the back of your throat. Is there mucus in your throat? A thick coating? Or a lump in the throat that does not go away, no matter how many times you clear your throat? Maybe the mucus in your throat started only in the morning. You woke up, cleared your throat several times, drank some water, and forgot about it. But slowly, the persistent throat mucus began staying longer. Now you may clear your throat during breakfast, while speaking, after eating, or even while trying to sleep. You may carry water everywhere. You may use throat lozenges every day. You may avoid dairy, drink warm tea, take cough medicine, or try home remedies. But the mucus in your throat keeps returning because the real cause may never have been identified. I'm Dr. Nathon Fox, and today I want to explain why you always have mucus in your throat after 60. Doctor explains the real cause. Here is what you need to understand. Mucus is not always the problem. Your body naturally produces mucus to protect your nose, throat, and airways. Mucus traps dust, bacteria, viruses, smoke, and other particles before they can move deeper into your lungs. The problem begins when too much mucus is produced, when mucus becomes thick and sticky, or when your body cannot clear it properly. That is when you may feel persistent throat mucus, constant throat clearing, a rough voice, coughing, or a lump in the throat. After 60, the system that moves mucus may become less efficient. Your airways contain microscopic structures called cilia. These cilia move together to carry mucus and trapped particles away from the lungs and throat. As you age, this mucus clearing system may slow down. That means a small amount of irritation that would have cleared quickly when you were younger may remain for much longer after 60. Silent reflux, postnasal drip, dehydration, smoke, infection, or medication irritation may therefore feel stronger and last longer. But do not assume that persistent throat mucus is simply part of aging. Your age may make mucus harder to clear, but age alone does not explain why the mucus is being produced. Today I will explain 5 possible causes of mucus in your throat. The first cause is silent reflux. The second cause is postnasal drip. The third cause may be your blood pressure medication. The fourth cause is dehydration. The fifth possible connection is gut health and inflammation. You also need to know that many people do not have only one real cause. Silent reflux and postnasal drip may happen together. Dehydration may make the mucus thicker. Blood pressure medication may keep the throat irritated. Constant throat clearing may then create even more irritation. Before we begin, write "morning" in the comments if your mucus in your throat is worst when you wake up. Write "all day" if the persistent throat mucus stays with you throughout the day. Your answer matters because mucus that is worst in the morning may point towards silent reflux, overnight postnasal drip, dry air, mouth breathing, or dehydration. Mucus that stays all day may be more connected to chronic postnasal drip, allergies, medication, smoke, reflux during the day, or another ongoing problem. Let's begin with the first possible real cause, silent reflux. Most people understand regular acid reflux as burning in the chest or heartburn after eating. But silent reflux may affect the throat without causing the burning feeling people expect. Silent reflux is also called laryngopharyngeal reflux. It happens when stomach contents move upward toward the throat and voice box. The throat is much more sensitive than the stomach, so even a small amount of reflux may cause irritation. When the throat becomes irritated, your body may respond by producing mucus to protect the tissue. You may then feel mucus in your throat, constant throat clearing, hoarseness, coughing, or a lump in the throat. This is why silent reflux can be difficult to recognize. You may not have chest pain. You may not feel acid coming upward. You may simply wake up with persistent throat mucus and assume the problem is in your lungs or sinuses. Ask yourself these questions. Is the mucus in your throat worse in the morning? Does your voice sound rough when you wake up? Do you clear your throat after eating? Does the lump in the throat become worse after a large meal? Does the problem increase when you lie down or bend forward? These signs do not prove silent reflux, but they may provide an important clue. A woman I'll call Margaret was 67. Every morning she woke up with mucus in her throat and a rough voice. She did not have heartburn, so she never considered silent reflux. She used lozenges, cough medicine, and warm tea, but nothing solved the problem. When Margaret reviewed her routine, she realized that she often ate dinner late, had a snack before bed, and lay down shortly afterward. Her doctor evaluated her and explained that silent reflux could be irritating her throat during the night. Margaret began finishing dinner earlier, stopped eating within 3 hours of lying down, and reduced the large evening meals that made her symptoms worse. Her persistent throat mucus did not disappear overnight, but her mornings gradually became easier. This is an important point. The throat may take time to recover because throat clearing and reflux can create a cycle. Reflux irritates the throat. The throat produces mucus. You clear the throat repeatedly. The throat clearing causes more irritation. That irritation creates a stronger urge to clear the throat again. If you suspect silent reflux, try not to forcefully clear your throat every few minutes. Instead, take a small sip of water, swallow gently, or use a gentle cough when necessary. This may reduce repeated injury to the throat. Meal timing also matters. Avoid lying down for at least 3 hours after eating. Large meals increase pressure in the stomach, making reflux more likely. Smaller evening meals may help some people. Certain foods and drinks may trigger silent reflux in some people. These can include alcohol, chocolate, peppermint, coffee, carbonated drinks, spicy foods, acidic foods, and high-fat meals. But triggers vary, so do not remove every food without identifying your own pattern. Keep a simple 7-day record. Write down what you eat, what time you eat, when you lie down, and when the mucus in your throat becomes worse. A clear pattern may help you and your doctor understand whether silent reflux is part of the real cause. Do not begin long-term reflux medication without medical guidance. Persistent throat symptoms have many possible causes, and treating yourself for silent reflux without an evaluation may delay the correct diagnosis. Now let's move to the second possible cause, postnasal drip. Postnasal drip happens when mucus from the nose and sinuses drains down the back of the throat. You may not always feel a blocked nose. You may not have severe sinus pain. Sometimes the only sign is persistent throat mucus and constant throat clearing. Postnasal drip may be caused by allergies, a cold, sinus inflammation, dry air, smoke, dust, strong smells, certain foods, or non-allergic irritation. After 60, changes inside the nose may also affect how mucus moves. Many people assume postnasal drip must be an infection, but infection is only one possible cause. Allergic postnasal drip may come with sneezing, itchy eyes, watery eyes, or a runny nose. Non-allergic postnasal drip may worsen with temperature changes, perfumes, smoke, cleaning products, or spicy food. A man I'll call Robert was 70. He had persistent throat mucus but could breathe through his nose. Because he had no facial pain, he assumed his sinuses were not involved. Robert noticed that the mucus in his throat became worse after cleaning his house and during certain seasons. His doctor evaluated him and found signs of nasal inflammation and postnasal drip. The mucus was being produced in the nose, but Robert felt it in the throat. This is why the location where you feel mucus is not always the location where the problem begins. One of the simplest tools for postnasal drip is saline nasal rinsing. A saline rinse may help remove mucus, dust, pollen, and other irritants from the nose. But nasal rinsing must be done safely. Never use ordinary tap water directly inside a neti pot or nasal rinsing bottle. Use water labeled distilled or sterile, or use tap water that has been boiled properly and then cooled. Follow the instructions that come with the nasal rinsing device and saline packet. Clean the device after every use and allow it to dry. Do not share the device with another person. A pre-mixed saline packet is safer than guessing the amount of salt yourself. Too much or too little salt may cause burning or irritation. Do not force a rinse through a completely blocked nose. If you recently had nasal surgery, have frequent nosebleeds, severe ear problems, or a weakened immune system, ask your doctor before beginning nasal rinsing. One rinse may provide temporary relief, but postnasal drip often requires consistency. If your doctor says nasal rinsing is appropriate, use it according to the recommended routine rather than only once when the symptoms become severe. Antihistamines may help when allergies are the cause, but some antihistamines can make mucus feel thicker or cause dry mouth. Older antihistamines can also cause sleepiness, confusion, constipation, or urinary problems in some seniors. Do not assume that every over-the-counter allergy medication is safe after 60. Ask your doctor or pharmacist, especially if you have glaucoma, prostate problems, high blood pressure, heart disease, or take several medications. Some nasal sprays may help specific causes of postnasal drip, but they must be used correctly. Decongestant nasal sprays should not be used longer than directed because they may cause rebound congestion. Steroid nasal sprays may take several days of regular use to provide their full effect. The right treatment depends on the real cause of the postnasal drip. Allergies, infection, nasal polyps, non-allergic rhinitis, and medication effects may require different approaches. If the mucus has a bad smell, drains from only one side, is repeatedly mixed with blood, or comes with facial swelling, high fever, severe headache, or vision changes, contact a doctor. Now we come to the third possible cause: blood pressure medication. Blood pressure medication saves lives. It reduces the risk of stroke, heart attack, kidney damage, and other serious problems. Never stop blood pressure medication on your own. But one specific group of blood pressure medication, called ACE inhibitors, may cause a persistent dry cough, throat irritation, or constant throat clearing in some people. ACE inhibitors include medications whose names often end in pril, such as lisinopril, enalapril, ramipril, benazepril, and others. But do not identify your medication only by the ending. Ask your pharmacist or doctor. These medications may increase a substance called bradykinin. In sensitive people, this can create a dry tickle, cough, or irritated feeling in the throat. The reaction may begin soon after starting the medication, but it may also begin weeks or months later. This delay is why many people never connect the blood pressure medication with the throat problem. A woman I'll call Helen was 73. She had taken a new blood pressure medication for several months before she noticed constant throat clearing. She assumed the mucus in her throat was caused by age or allergies. Her pharmacist reviewed her medication and explained that she was taking an ACE inhibitor. Helen discussed the problem with her prescribing doctor. Her doctor decided whether an alternative medication was appropriate based on her complete health history. Helen did not stop the blood pressure medication herself. That is the correct approach. If you take blood pressure medication and have developed persistent throat mucus, a dry cough, or constant throat clearing, ask your pharmacist one direct question. Is this medication an ACE inhibitor, and could it be irritating my throat? Do not skip doses while waiting for an appointment. Suddenly stopping blood pressure medication may allow your blood pressure to rise and can be dangerous. If your doctor believes the medication is contributing, another class may be considered. But that decision belongs to your prescribing doctor because every medication has benefits, risks, and reasons it was selected. Blood pressure medication is not the only medication that can affect the throat. Some medicines may cause dry mouth, reflux, or dehydration. Inhalers may cause throat irritation if used incorrectly. Some antihistamines may dry secretions. Certain medications may make reflux more likely. Bring a complete medication list to your appointment. Include prescription medication, over-the-counter medication, vitamins, herbal products, and supplements. Write down when the throat symptoms began and when each medication was started or changed. The timeline may reveal a connection that is otherwise easy to miss. Now let's move to the fourth cause, dehydration. Mucus contains a large amount of water. When your body is well hydrated, mucus may remain thinner and easier to clear. When you are dehydrated, mucus may become thick, sticky, and difficult to move. After 60, thirst may not always be a reliable warning. You may need fluid even when you do not feel strongly thirsty. Some medications may also affect fluid balance or increase urination. This does not mean every senior should force a large amount of water. People with heart failure, kidney disease, liver disease, or low sodium may need fluid limits. Follow the fluid target provided by your doctor. But if you have not been told to limit fluid, a consistent drinking routine may help prevent dehydration. Instead of waiting until the end of the day, drink reasonable amounts throughout the day. A man I'll call George was 71. He drank coffee in the morning, but very little water until dinner. By afternoon, the mucus in his throat felt thick and difficult to clear. George began keeping water nearby and drinking small amounts regularly. He also reduced the amount of caffeine he was using to replace water. The mucus in his throat became easier to clear, although hydration did not remove the underlying postnasal drip. That is important. Dehydration may worsen persistent throat mucus, but drinking water does not cure silent reflux, allergies, infection, or a medication side effect. Hydration is support, not a complete diagnosis. Water, soup, and other appropriate fluids may count toward your intake. Water-rich foods may also contribute. But sweet drinks can affect blood sugar, and excessive caffeine or alcohol may worsen reflux or sleep. Check the color of your urine as a rough clue, but remember that vitamins and medications may change urine color. Very dark urine, dizziness, confusion, weakness, dry mouth, low blood pressure, or very little urination may require medical attention. If drinking more makes you short of breath, increases swelling in your legs, or causes rapid weight gain, contact your doctor because these may be signs of fluid retention rather than dehydration. Dry indoor air may also make the throat feel worse. A clean, cool mist humidifier may help some people, but it must be cleaned correctly. A dirty humidifier can spread mold or bacteria and worsen breathing problems. Keep indoor humidity moderate. Too much humidity may encourage mold growth, which can worsen postnasal drip and airway irritation. Now we come to the fifth possible connection: gut health. The digestive system and the airways communicate through the immune system. Researchers sometimes describe this relationship as the gut-lung axis. Gut health may influence inflammation, but this field is still developing. It would be inaccurate to say that poor gut health is a proven main cause of every case of mucus in your throat. Silent reflux, postnasal drip, medication effects, infection, allergies, smoking, and lung disease are more direct explanations that should be considered first. But gut health may still matter as part of the full picture. A diet very low in fiber, repeated antibiotic use, poor nutrition, chronic illness, and other factors may affect the gut microbiome and inflammation. Supporting gut health does not require an expensive supplement. For many people, it begins with a balanced diet containing vegetables, fruit, beans, whole grains, and other fiber-rich foods that fit their health needs. Fermented foods, such as plain yogurt or kefir, may fit some diets, but they are not required, and they do not cure persistent throat mucus. People with diabetes should watch added sugar, and people with dairy intolerance or allergy should choose appropriate alternatives. Do not take probiotic supplements simply because a video tells you they will remove mucus in your throat. Products vary, evidence depends on the condition, and some people with weakened immune systems need to be cautious. Gut health also connects with silent reflux. Large, late meals, alcohol, high-fat food, and certain trigger foods may worsen reflux. Constipation and abdominal pressure may also make some people feel more uncomfortable after eating. So when we discuss gut health, the practical goal is not to detox your body. The goal is to support regular digestion, balanced nutrition, and medical care for ongoing digestive symptoms. Now let's talk about two causes that often work together: silent reflux and postnasal drip. Imagine that postnasal drip is sending mucus down the back of your throat throughout the day. Then silent reflux irritates the same throat during the night. The postnasal drip creates mucus. Silent reflux makes the throat more sensitive. You clear your throat repeatedly, creating more irritation. Dehydration makes the mucus thicker. This cycle can make a mild problem feel constant. This is why treating only one part may not provide full relief. You may improve silent reflux but still have allergies. You may rinse the nose but continue eating late at night. You may drink more water but still take a medication that irritates the throat. The real cause may be a combination. Now I want to explain why constant throat clearing can become part of the problem. Clearing the throat forcefully brings the vocal cords together. Doing this repeatedly may irritate the throat and voice box. The more irritated the tissue becomes, the more strongly you may feel that something is sitting there. When the urge appears, try a small sip of water followed by a swallow. You may also try a gentle cough rather than a harsh throat-clearing sound. A speech-language pathologist or voice specialist can teach safer techniques when throat clearing has become a strong habit. Now let's create your practical action plan. Tonight, finish eating at least 3 hours before lying down. This may reduce nighttime silent reflux. Avoid a large evening meal, and notice whether specific foods make the mucus in your throat worse. If reflux may be involved, elevate the head of the bed using a safe wedge or another method recommended by your clinician. Stacking several pillows may bend the neck and may not provide the same effect. Tomorrow morning, drink an appropriate amount of water if you have not been placed on a fluid restriction. Give the mucus time to loosen before repeatedly clearing your throat. Look for signs of postnasal drip. Do you have sneezing, nasal congestion, itchy eyes, a runny nose, or mucus draining down the throat? Write down when these symptoms become worse. If a saline nasal rinse is appropriate for you, use only distilled, sterile, or correctly boiled and cooled water. Use a prepared saline packet and clean the device after every use. This week, review your medication list with your pharmacist. Ask specifically about ACE inhibitors, medication-related dry mouth, dehydration, reflux, and throat irritation. Keep a 7-day symptom record. Write down when the mucus in your throat is worst, what you ate, what medication you took, whether your nose was congested, how much fluid you drank, and whether you were exposed to smoke, dust, or strong smells. Do not change everything at once. If you make 5 changes on the same day, you may never know which one helped. Start with the safest and most relevant change, then monitor the result. Now let's discuss popular home remedies. Warm water may soothe the throat and help loosen mucus. It is supportive, but it does not identify the real cause. Honey may temporarily soothe throat irritation, but it does not cure silent reflux, postnasal drip, or a medication side effect. People with diabetes should count the sugar and use caution. Dairy does not automatically create mucus in every person. Some people report that dairy makes existing mucus feel thicker, but this is not the same as proving that dairy causes excess mucus. Track your own pattern instead of removing an entire food group without reason. Apple cider vinegar is often promoted for silent reflux, but it may irritate the throat or worsen symptoms in some people. Do not use additional acid as a treatment without discussing it with a clinician. Steam may provide temporary comfort, but very hot steam can cause burns. A warm shower or properly cleaned cool mist humidifier is safer than placing your face over boiling water. Now let's discuss the warning signs you should never ignore. Persistent throat mucus is often caused by manageable problems, but some symptoms require medical evaluation. Contact a doctor promptly if you have blood in the mucus, worsening difficulty swallowing, pain when swallowing, food becoming stuck, unexplained weight loss, a persistent lump or swelling in the neck, or a voice change that does not improve. Also seek care for a cough lasting several weeks, repeated chest infections, fever, night sweats, shortness of breath, wheezing, chest pain, or mucus coming from the lungs rather than only the throat. Call emergency services for severe difficulty breathing, choking, blue lips, sudden facial weakness, sudden trouble speaking, or inability to swallow saliva. If you smoke or have a history of smoking, persistent hoarseness, coughing, blood, or unexplained weight loss deserves prompt evaluation. Now let's review the 5 possible causes. The first possible real cause is silent reflux. It may irritate the throat without obvious heartburn, especially after meals or while lying down. The second possible cause is postnasal drip. Mucus may drain from the nose and sinuses down the back of your throat, even when your nose does not feel severely blocked. The third possible cause is blood pressure medication, especially an ACE inhibitor. Do not stop it yourself, but ask your doctor or pharmacist whether it may be contributing. The fourth possible cause is dehydration. Not having enough fluid may make mucus thick and difficult to clear, but fluid intake must fit your heart and kidney health. The fifth possible connection is gut health and inflammation. This relationship is still being studied and should not distract from more direct causes, but a balanced diet and healthy digestion support overall health. Now think about your own pattern. If the mucus in your throat is worse in the morning, consider silent reflux, overnight postnasal drip, dry air, mouth breathing, or dehydration. If it becomes worse after eating, consider silent reflux and meal triggers. If it comes with sneezing and itchy eyes, consider allergies and postnasal drip. If it began after a medication change, ask about a blood pressure medication or another medicine. If the mucus is thickest late in the day and you drink very little, dehydration may be making it worse. If you have several of these patterns, more than one cause may be working together. The goal is not to remove all mucus from your body. You need mucus to protect your airways. The goal is to identify why the mucus is collecting, why it has become thick, and why your throat remains irritated. Write mucus in the comments if you want a simple throat mucus checklist. Also tell me which possible real cause sounds most like your problem. Silent reflux, postnasal drip, blood pressure medication, dehydration, or gut health. If you are over 50 or 60 and deal with mucus in your throat, persistent throat mucus, constant throat clearing, silent reflux, postnasal drip, a lump in the throat, or senior health concerns, subscribe to Dr. Nathon Fox. On this channel, I explain senior health in simple language so you can understand the possible cause and speak more clearly with your doctor. This video is for educational and informational purposes only. It is not medical advice, diagnosis, or treatment. Persistent throat mucus may have many causes, including silent reflux, postnasal drip, allergies, infection, medication effects, dehydration, asthma, smoking, swallowing problems, or lung disease. Do not stop blood pressure medication or any prescription medication without speaking with the prescribing doctor. Do not begin reflux medication, allergy medication, supplements, or a new treatment plan solely because of this video. If the mucus in your throat continues, worsens, or comes with any warning sign, make an appointment with your doctor, an ear, nose, and throat specialist, or another qualified healthcare professional. After 60, persistent throat mucus is not something you have to ignore, and it is not automatically something you must accept as aging. Your body may be giving you a clue. The clue may come from silent reflux. It may come from postnasal drip. It may come from blood pressure medication. It may come from dehydration. Or several causes may be working together. I'm Dr. Nathon Fox. Listen to the pattern. Review your medication. Protect your throat. Use nasal rinsing safely. Avoid eating immediately before bed. Stay appropriately hydrated. And ask your doctor to help you identify the real cause. Because when you understand why you always have mucus in your throat, you can stop chasing temporary relief and begin addressing the problem that is keeping it there. I'll see you in the next video.